Hi, my name is Mary Vukusevich, and in this short video I'm going to take you through an overview of the medical management of glaucoma. In 2010, the National Health and Medical Research Council published these guidelines for, as it says on the screen there, for the screening, prognosis, diagnosis, management and prevention of glaucoma. It's very important that you familiarise yourself with these guidelines because these form the underpinning basis for treatment of glaucoma according to all the different types of treatments that you can actually give a patient. So according to the NH and MRC guidelines, the goal of currently available treatment for patients with glaucoma is to preserve their visual function by lowering their intraocular pressure below a level that potentially could cause damage to the optic nerve. And whilst there are those very clear and established guidelines for glaucoma treatment, the medical regime must be individualised for each patient, and that's extremely important. Now, the ideal treatment regime comprises these 4 key points. Firstly, it needs to minimise the impact or burden of the disease on the patient. 2, it needs to decrease the risk factors to prevent visual impairment that would affect a patient's life. 3, it needs to minimise the impact of side effects of treatment. And 4, it needs to encourage compliance, because compliance is a very key factor in the management of glaucoma, particularly when it comes to topical medication. So the NH and MRC guidelines state that the specific target intraocular pressure should be established for each patient once they're diagnosed with actually having glaucoma or suspected of having glaucoma. And the primary purpose of any follow-up in the clinic or review of the patient is to work out whether or not this target intraocular pressure has actually been achieved, or whether there's evidence that the glaucoma has progressed further. And so this provides the basis for either continuing the medication that the patient's been put on or changing the glaucoma management plan. So the usual recommendations suggest that there should be about a 25% reduction in IOP from baseline at diagnosis. However, it's suggested that even a lower intraocular pressure than that is needed when the glaucoma is more severe. So again, this goes back to individualising the treatment program depending on the patient. And the table that's here on the screen is from the NH and MRC guidelines, of course, on page 80. And it outlines the glaucoma classification on the left, so POAG, primary open-angle glaucoma, or NTG, normal tension glaucoma, and any individual potential risk factors that the patient might have in the next column. And then it gives you the suggested target intraocular pressure levels. So what sort of treatment can patients have for glaucoma? Well, basically we can divide the treatment methods into these 3 broad categories, and they are medication, laser intervention, or surgical intervention. I'm not going to discuss those here. I'm going to leave these for a separate online lectures, so please look out for those.